My name is Jeff Kahn. I'm a hepatologist at the University of Southern California, and I'm going to be talking about primary biliary cholangitis, but specifically about symptom control and quality of life. This is a liver disease that actually affects many organs in many different ways. And when patients have symptoms, they don't necessarily correlate with the degree of actually liver disease. So patients can have very early disease and be very symptomatic. So that's what we're going to discuss today. In terms of the common symptoms of PBC, I would say by far the most common symptoms are fatigue and pruritus or itching. These symptoms can actually affect patients' mental health in many different ways, because if somebody's very uncomfortable and doesn't sleep well, it could really affect their workday, their relationships with their families, and just how they view their entire life. And so I think symptom control and identifying symptoms is really, really important. So in terms of fatigue, I often ask my patients about whether or not they're sleeping well. Unfortunately, the pruritus in PBC tends to be worse at night, and so patients often can't sleep. Patients are often given antihistamines to help with the itching, but this is not a disease that causes itching due to histamine release and allergies. But sometimes the antihistamines can actually help patients in terms of their symptoms because of not sleeping well, because it actually can help them sleep better. It doesn't really help the pruritus very much directly. In terms of the other issues regarding sleep are, I make sure that they have good sleep hygiene, making sure that patients aren't very active before they go to sleep in terms of bright lights, watching television, using their computer. So just sort of a slow ease into sleep. I often send patients to sleep specialists because oftentimes they're not sleeping well because they have sleep apnea, or sleep specialists can actually help them with their sleep hygiene and also make sure that their bedroom partners don't have issues with snoring and sleep apnea, because that can affect the partner's sleeping as well. In terms of the pruritus directly, that's very difficult to treat. I usually start with cholestyramine, which is a powder that's mixed in some water or juice. And if the patients have a gallbladder, I ask them to mix about 4 grams in about 8 ounces of water or juice, drink half the volume before and after, and then after breakfast. The reason that we do that in patients with a gallbladder is early morning, when somebody actually starts eating, their gallbladder releases bile very quickly. Some of the problems that actually cause pruritus in these patients are located in the bile, although we don't have all the answers to that. And so you bind up things that can actually promote itching. If somebody doesn't have their gallbladder, then they just take a whole dose after breakfast, and then we repeat after lunch, but we don't have to do it before lunch, just after lunch, the whole 4 grams. If that doesn't work, we sometimes do the same thing at dinner time or even other times during the day. The major treatment for PBC is ursodeoxycholic acid, which actually is bound by the cholestyramine. So be very careful not to give them around the same time. Very, very important. In terms of other symptoms that patients can have, they can have symptoms due to thyroid disease, such as hypothyroidism, which is most common, or hyperthyroidism. So patients can be very sluggish if they have hypothyroidism, or they can be very hyper if they have hyperthyroidism. So checking thyroid tests are very important. Patients with primary biliary cholangitis also can develop night blindness, and that's because of vitamin A malabsorption. And so it's very important to check vitamins and treat that appropriately. Vitamin D malabsorption is common as well, and so that can lead to osteoporosis. And as you know, many of our patients are females who are more prone to osteoporosis. And so checking vitamin D levels, providing calcium is very important, because obviously we don't want to have patients developing fractures, which can lead to serious morbidity and even mortality, especially with hip fractures. In terms of treating those vitamin deficiencies, sometimes we need to use very high doses of vitamin A and vitamin D. I tend to give my patients a preparation called ADEK, which stands for A, D, E, and K, which are the fat-soluble vitamins that are malabsorbed, and we actually have gummies. There's a liquid, and I think they're also chewables. And those can provide preparations that actually allow better absorption of these vitamins in patients that malabsorb fats. And that's a big problem for the patients. We have APPs in our practice, and I believe that APPs are very, very valuable because they really develop very close relationships with patients that in many cases I think are even closer than relationships that physicians have with the patient. And I find that there's a real trust, a real bond, and that can be very helpful, because sometimes the symptoms that patients have, they're even a little bit embarrassed to discuss. And it's really nice if they can have a close relationship with a provider. Or other signs and symptoms that patients can have something called vitiligo, which is actually lightening of the skin because of issues with melatonin in areas of the skin. And, some patients are embarrassed by that. And I think, helping patients to cover up those areas if they're embarrassed by them, and also just to feel, happy and healthy in their bodies. It's also important to promote exercise, which actually is very important for mental health. I like to send patients to their physical therapists to help with the proper exercises because you don't want patients to overexert themselves or do too much lifting. But there's a good balance between cardio and also doing some degree of resistance training. Very important also for preventing osteoporosis and promoting heart health. It's also very important to put patients in touch with other patients with PBC, as they can actually discuss symptom control. And a lot of my patients get really sound advice from other patients with PBC. The American Liver Foundation provides support groups in many places. And in our area in Southern California, there are a couple of different societies that actually have regular seminars on various topics, including primary biliary cholangitis. And by just looking on the internet, you can find resources in your area and some national resources as well. So in closing, I would say that PBC these days a pretty easy to treat disease because we actually get referred patients that are very early and the treatment is very effective. We have some new treatments that just came out this past year, and those actually are specific treatments that can actually improve pruritus. But those are second-line treatments if ursodeoxycholic acid is either not tolerated or not completely effective. Again, identifying mental health issues in these patients is really important because that's very important for quality of life. Identifying sleep problems, making sure that we identify vitamin deficiencies, treating their pruritus. If the cholestyramine doesn't work, there are some second and third line agents which can be used. And then finally, in patients with more advanced liver disease, identifying whether the patients are actually developing decompensation and need to be considered for liver transplantation. I should mention that liver transplantation for PBC in general is very effective. These patients tend to be otherwise quite healthy. Their outcomes are excellent. There is a significant risk of recurrence of PBC post-transplant. And I will say that even when there's recurrence, it rarely causes that liver to fail. So patients do well in the long run, and we do have strategies to help prevent recurrence and keep those patients healthy. Thank you for listening today. For more information, please visit the GAP website or download the GAP ACE